Hey, it's Dr. Bosworth here with North Texas Plastic Surgery. So, you've had your implants for a while. Maybe you're starting to wonder, do I need these replaced? Or maybe you're just wanting something done, a change in exchange for a different size, or maybe you think you might need a lift at this point. Now what? I wanted to touch on some of those questions because they're common questions that I hear in consultation or in appointments. There's some common guidelines that I can talk about, but it is a very individualized decision. So the best way to determine what is best for you is to come in and talk to one of us or your plastic surgeon. In general, the FDA, or the body that oversees medical devices, states that breast implants are not lifetime devices. They say that the length of time that an implant will last in each individual varies significantly. Some of the more common, but still very rare implant reasons why you might need an exchange or removal are things such as capsular contracture or a tight scar around the implant or a rupture. There's recommendations for screening for some of these complications, and it's important to talk to your plastic surgeon to find out what the recommendations are before you have your surgery. Other reasons why you might want a revision or removal of your implants is because you might just be unhappy with how things are looking. Unfortunately, gravity is always going to be a thing, and your body will continue to age around that implant. It might be time for a lift if you just had an augmentation initially, or you might just want to change the size of the implant, go bigger, go smaller, or even have them removed altogether. Oftentimes with doing an exchange, your plastic surgeon might recommend a lift or a mastopexy with that procedure. This could be recommended because of some of the tissue stretch and to get things more lifted and perky. If you need a lift, and the type of lift you might need is really a decision between you and your plastic surgeon. Oftentimes this might be an obvious decision, but sometimes, depending on your goals, this might require a longer discussion between you and your plastic surgeon. A lot goes into the decision about whether to remove or replace your implants. Sometimes it might be necessary to fix a problem, but sometimes it can be a very personal decision about whether you want to undergo another surgery to change something. For silicone implants, the FDA recommends image screening, and that's MRI or ultrasound screening, at certain periods of time after you've had your implants placed. The newest generation of silicone implants are great. If they get a rupture in them, that silicone tends to stay inside the gel and it does not tend to leak out. These are often referred to as gummy bear implants, and they're one of the reasons why you might need imaging to detect a leak, because sometimes leaks can go undetected, which is also referred to as a silent rupture. You may never even know that there's a small tear in your silicone implant. With saline implants, on the other hand, you'll know pretty quickly. That breast that has a rupture will go flat and deflate. If the breast procedure is all we're doing for you that day, you can often go home the same exact day, and recovery should be similar to the initial procedure that you had. If you've even been considering implant exchange removal, just come in and talk to us and we can talk about what options are best for you. If you're interested in more plastic surgery content like this, just like, comment, and subscribe.